Good afternoon, everyone. Welcome to panel discussion on Digital Health 2020. Actually, we're having a CBRC conference on digital health, and the panel discussion would be one of WEP event. So first, we'd like to introduce ourselves briefly. Then we'd like to go to kind of Q&A with panelists. And today, I'm moderating with Dr. Fadwa. I'm Takashi Gojobori. I'm a distinguished professor of bioscience and acting director of CBRC, Computational Bioscience Research Center in KAUST.
I am Fedwa Atiga, Chief Research Officer in a global oncology firm that builds cancer centers in underserved markets in Africa. I'm an advocate of the marriage between clinical data, real-world data from the hospitals, and big data and artificial intelligence, and looking forward to giving you an idea about this exciting world.
My name is Ahmed Al-Barak. I'm a professor in the College of Medicine. And King Saud University. I'm very delighted to be with you. I'm happy to see you as well here. And my specialty is biomedical informatics, and I'm focusing more on consumer health informatics and consumer engagement. And would like also to share experience and research with you today, inshallah.
Hi, my name is Nasser Al-Jihani. I'm a family medicine physician and a clinical informatician. My focus is around delivering high quality, safe patient care using patient data and IT systems. Very happy to be here. This is a cutting edge institution, and it's a great opportunity to be here and share and listen to what you guys have here. Thanks.
Hi, everyone. My name is Malik Saghafi. I'm a physician pathologist and a researcher coming from King Abdulaziz City of Science and Technology, Life Science and Environmental Institute, National Genome Center, and also as a pathologist and a clinician, I practice in King Fahd Medical City in Riyadh. This was the most interesting and exciting part of my trip today, to see you all, the students especially, and the people on the web.
Hi everyone, I'm Ahmed Al-Nazi. I'm CMO of WEP2020. So happy to be here and to participate in this great panel.
Hello, my name is Robert Hörndorf. I'm an assistant professor in computer science here at KAUST, and I'm also a member of the Computational Bioscience Research Center, where most of my work is on integrating different types of biomedical data and building knowledge-based models, predictive models, and also diagnostic models using this data.
Okay, thank you so much, everyone. I think we have to keep time, and we have to finish this panel discussion sharply at 5 p.m. And therefore, we'd like to ask you to have answers from questions as much as, simple, precise, and not so long, please. And the first half, I would like to moderate. Then second half would be moderate Fadwa. Then remaining time, I would like to solicit questions, comments from floor, as long as we have time. But before that, I'd like to start with very difficult question. Actually, I think I have to answer it by myself, but I would like to ask Robert first. What is the definition of digital health according to your term? Of course, all panelists might have a different view. Therefore, first, let us listen to his definition. Then you might add or kind of modify, but whatever. But anyway, asking this question, then having his answer, then I would like to ask each of you my question. Is it okay? Okay, Robert, please.
Okay, I will give a try. I think everybody will have a different answer for this question. But as a professor in computer science, maybe I have a very unique perspective amongst the panelists here. For me, of course, digital health means we use digital technologies, any kind of digital technologies, in order to improve our own health and also manage our own health. And there is different needs for this. I will try to be very brief. 50 years ago, we would also do clinical studies and we would obtain data from clinical trials. We would do experiments, different types of experiments, but we were not very precise. We could only obtain maybe 10, 15, 20, 50 different types of variables which we would observe. And now about an individual. And then we would have cohorts also of size of 1,000, but these 50 variables we could analyze ourselves. And now, because we have much better technologies to go much deeper, much more fine-grained, we can look at genes, we can look at molecules floating around in our cells, at RNA, at proteins, at metabolites. We can observe or we can record behavior at every single minute of the day. I wear this smartwatch here which records my heart rate throughout the day. And it's no longer 50 variables, it's no longer 100, it's millions or even billions of variables which we will record. A genome is billions of base pairs. So we have billions of variables which we record, and there's a need to use other types of technologies. We cannot have a statistician on paper analyzing or building models. We need digital technologies to help us to interpret the data. But there's another dimension of digital health. It's not only the analysis, and this is mainly...
Robert, please be brief.
Very brief, yes. So digital health is also, I will have the means, I look at my smartphone, I can use my heart rate and the sensors that I wear in order to improve or monitor my own health. Sometimes my heart rate goes up, I know maybe too much stress, I need to tune it down, and I can intervene. And the third aspect is, and we have heard this morning, there are communities, for example, in remote areas, they might not have access to healthcare as we have in Jeddah or in Riyadh, and they have diseases, sometimes very severe diseases. And digital technologies allow them to find other people in platforms like Patients Like Me, find communities where other patients share similar signs and symptoms, take similar drugs, and they can find support, not only from physicians, but also from other patients. So I think it's the way to use digital technologies in all aspects, not just analytically, to improve and address our health.
Okay, thank you so much, Robert. Maybe in short, kind of big data is coming in medical domains, clinical domains, then how we can deal with by utilizing AI or machine learning, or maybe new innovative apparatus. Okay, then I would like to ask from Professor Ahmed, my question to all of you, why we work on digital health or personalized medicine right now? Why it was not 10 years ago? Why not 5 years later? Why we have to work on? Then also I'd like to ask you, what would be the role of KAUST in this very important issues? So from those outside, you might see the KAUST from your perspective, and Robert, maybe from you inside, you might answer to the question. Then from Ahmed, please.
Okay, thank you very much. I think this is the difficult question, not that one, but I'm going to answer both. So for digital health, if we look at it from a clinical perspective, it is enabling or supporting health and well-being using any digital approaches. On the other side, supporting healthcare services. So what we are trying to do, and why we are doing this, actually, now we have no choice because demand for healthcare is increasing, and this is an opportunity. And in healthcare and health also in population, we should take any opportunity to support health well-beings and healthcare services. And as long as we have the information and digital revolution, we should be the first in healthcare to utilize this revolution and these innovations to support our populations, people, patients, and consumers. So I think the sooner the better. This is a straightforward answer. And what is the role of KAUST? I think the role of KAUST is there because I think every individual in this room has a role on the future of healthcare, and it depends not only on the service you are providing for your patients, it's also for the research you are doing to support this community, because healthcare is a knowledge base, and the knowledge is coming from you. So every student should think about how they can contribute to healthcare through digital health. So I think we are here to inspire and try to push everyone, either in other universities or KAUST. And I think KAUST is playing a major role because it's a science and technology university, and I think it's going to be a major hub for research and technology in this part of the world.
Thank you, Ahmed. Then Nasser?
So why digital health now? So I think there are 4 important reasons. One is it's the expectation. So now we have a new generation that was born using digital means for communication, for education. And their expectation is that their health will be provided using digital means. 2 is we can do it. We know we can do it. We have bright minds, we have resources, it can be done. 3, I think, which is very important that can really drive digital health into healthcare is the cost. So there is a need, there is a very, very big need to reduce cost in healthcare. Because think about it. Every dollar or every 1 real you spend on healthcare, you are spending that $1 away from education, away from infrastructure, away from tourism, away from things that people can enjoy. So there is a big need to decrease cost in healthcare. And we need digital means to help us decrease cost. We need to create platforms that can help millions of patients with the lowest cost possible. Relying on humans to deliver healthcare should be something in the past. Humans, as I said in my presentation earlier, are risk whenever you have operations. You rely on memory, rely on cognitive functions. There's cognitive biases. There are a lot of things that can go wrong in operations when you have humans kind of in there. So KAUST, I think, it's a cutting-edge institution. You have a lot of research going on, funds. You have bright minds here. People can really help in improving digital health.
Thank you. Malik?
So why digital health now? Because there is no better time in the history like now. We, in a healthcare system, accumulated a huge data sets from all kind of resources you can imagine. From the historic medical records we have written for tens of years, to digital medical records, to different biometric input from all the devices you guys wear, and from all the imaging that we have from different sources, etc., from patient self-reported finding, from clinical reporting, a lot of data. Add to it the data we get from our advanced technology, genomic technology, Azure technologies. So we have a huge data set that you're sitting on it now, and it's time to work on it. And another thing is, now think about some big biotech company, or actually they are not bio, they are tech company, Google, Amazon. Why they're working on it right now? Many of you heard about Google AI tool to detect cancer, mammogram better than doctor. Amazon already working in the cloud system for many years. It's a huge interest, and it's a new, I think, knowledge-based economy for this country. So think about it also from a business perspective. These giants are not getting to the game for nothing. They're looking for the future. So this is another thing. The third thing, we at the kingdom, we have a huge geography, diversity in population. our own problem from Hajj and a lot of the gathering happening in Umrah. We have our uniqueness and our problems as well, the inherited disorders that we cannot solve. We need a solution. Our medical staffing cannot help. We will never catch up. They thought opening more medical school will solve it. It will never solve it. I think the last estimate, maybe we need another 50 years or so just to cover our demand. So we'll never cover it. We need more digital doctors, more digital nurses, more digital counselors, more digital therapists to help us to reach this rural area. So there's a lot of things. And then we have KAUST. We have KAUST now. I consider KAUST as a powerhouse of our innovation, technology, and research in the Middle East area. So we have this bright mind. Every one of you, think about one story in your life. I'm sure you know somebody with some disability issues that at one point their family needs some sort of counseling or help, Down syndrome, autism, etc. After road traffic accident, they have an issue. Or know somebody with cancer that needed help that we couldn't find easily, or you get this wrong information on internet. So think about it from that aspect. I'm sure if you think you set yourself, you'll find one issue, even small issue, you can fix.
Thank you, Malik. Ahmed?
Yes, why digital health now? I think now we need to serve a lot of people in short time, like people in the rural area and far from the main hospital, like King Faisal Specialist Hospital, King Fahd Medical City. Those people, they need a good health, good doctors, and good follow-up. We can perform and we can give them a good service in a short time and less money spent and a good quality.
How about KAUST?
KAUST, I think there's a huge load on KAUST to do a lot of research and combine it with the clinical wise.
Thank you. Robert?
So I think so digital health now, I think it's exactly the technological advance which allows us to measure very deeply and very fine-grained, which requires digital technologies. But the role of KAUST from an insight perspective, I see mainly as a facilitator. KAUST has no medical school, but it has one great advantage. It combines a lot of great minds from all over the world which work on science and technology, and mostly basic science and development of technology without necessarily specifically focus on medical applications. And what I hope KAUST and the new initiatives at KAUST will facilitate is that KAUST could become a hub where not only digital scientists or data scientists would come, but also clinical doctors, medical doctors from the kingdom, where there's an exchange of information at essentially a hub of data analysis for the kingdom, but not only for the kingdom, but also beyond.
Thank you so much. So actually, before switching moderator to Fadwa, I'd like to ask one more question, and anyone can answer. Particularly, I wish MD, one of you are MD, some of you are MD, I would like to answer this question. Question is, KAUST doesn't have any medical hospitals. We have KMC, but a little bit, clinical practice, more, I would say, like a medical school. We don't have any clinical research institutions. We have some MD, but mostly, PhDs. So it looks that it can be a disadvantage working on medical science, but I feel it's kind of an advantage because for clinical side, it's easier to make a collaboration because so much complementary. You don't have so much AIs, big data analysis, more like innovative methodologies and experimental things. But you have patients, you have clinical, experiences. So how do you evaluate this lack of clinical domain at KAUST. From your side, it's easier to work, or how do you think? Do you understand the question? Anyone? Okay, then Malik. Malik?
As Robert said, you really don't need to have a medical school. Actually, this is an advantage. And if you take a benchmark, you have an MIT, the MIT. They don't have medical school. One of the greatest discovery, at least in the field of the AI and machine learning and big data analysis, came from the MIT researcher because they work together with their neighbors in Boston, different Harvard Institute and other departments. So you really don't need to have this. But we need the complementary role of each other. We as physicians, different family medicine or pathology, or even our colleagues from surgery, different things, we have ideas, we really touch patient directly. So we can have input what our real concern, even you can connect you directly with our patient to hear their concern. And add to equation your mindset of how to come with innovation. So I think it's actually advantage for you to not to have medical school. I don't think we need more medical school. There was one idea was to build more. We didn't need more. We need to actually to utilize the resources we have.
Thank you so much. Okay,
Yeah.
just a quick quiz.
Sorry,
quick
can I
answer,
add
please.
this? Yeah, I agree with Dr. Malak. You don't need a medical school. Now, there are two things in the clinical field. One is clinical operations, right? So you have patients and physicians and pharmacists interacting with each other, and then you have that kind of a mirror of what's happening on the ground, which is data. So you really need. I encourage that you try to get access to data as much as possible, especially clean data. But now, I remember when I was in my clinical informatics fellowship, my program director asked me to find a project to work on. So what I did, I sent an email to our department, a mass email. Tell me about a problem you want to solve, because I was looking for project ideas. And oh my God, my email was blown up of the amount of people starving for solutions for the problems we have. We have a lot of problems in healthcare. Get connected with people on the front line, hear them, understand what their problems are. There are your projects where you can work on them.
Thank you so much. Yes. Okay.
Yes, actually, I would like to look at it from a different perspective. I know it's great if you have a collaboration, but I think KAUST has a great opportunity because of the location, because that you should have here a medical center, and you should have a proper medical center. And I think having a medical school is going to be a great add for KAUST. I know you can complement for most of data with the collaboration with other institutions, but I think in this part of the kingdom, we don't have a proper medical center. And I think if you have a medical center, then it's going to be a great opportunity to have a medical school. And then applied research is much, much easier if you have patients. So I would agree partially with my colleagues, but I would disagree that medical school, I think, it is not a need. It is an opportunity for this, let's say, society, especially you have the King Abdullah next to you, and then in the same time, it's a great opportunity for your students. So I think it's an opportunity, and I think KAUST should think about having the medical center with medical school and other applied sciences as well.
Thank you so much, Ahmed. Then, Fadwa, please.
Okay, Nasser's comments to the students will be the leading segment for the questions, because many of the students in the audience come to KAUST attracted by its mission to be the house of wisdom for science and technology, and to impact their country, their population, and the worldwide. So it's important to hear your tips, because you come from the clinical part, on how to bridge this, what they call the valley of death, between translational research and clinical research. Many of the discoveries end up in publications, very few get adopted in the clinic, and as we heard now, the challenges we face and the demand is so high that we have to break apart from this traditional model and encourage quick adoption of clinical care and show the value of basic and translational research to the clinicians, which they don't many times acknowledge to support. So I'd like to hear your tips for the students to pick their research projects, to build the networks, to see themselves in 5 or 10 years in their career planning, to fulfill the potential of being clinical scientists and basic and translational researchers supporting clinical care. So we'll start with Ahmed.
Thank you very much. Normally, they start with me with the difficult questions. So I'm fine to answer the question. I think students in KAUST, I think they are a cream of the cream. I know so some of my relatives, they came to KAUST, they've been through different steps to be here, and I think it is not, you are not only here to study. You have to build your network with your professors, and I think this is part of your success. The network within your specialty, and I think it is very important for students from the first step that they started to decide on their own research with the professors, that they should think about building networks with other institutions that they think this is the proper place that they can collect data or apply their projects or even theories later. And I think other institutions are waiting for you. So you don't think that other institutions they're going to reject. No, they are waiting for somebody like you. They know, and they knew well that KAUST are sending excellent students with excellent supervision and professors. So I think you start your network from now. So you should take the lead as postgraduate student. You should take the lead and build your network. And I think this conference is one important opportunity that you start your networking and you recognize professors, clinicians, and professionals from other institutions, and you start to build your network. So don't attend events just to listen to knowledge, because you can gain knowledge in many different ways. One of them is online. But when you attend such an important events like this Digital Health 2020, I urge you to communicate with other students, with other professors, with other speakers, and then you will be able to start building your connections, and it's going to be very easy for your project and for the application future when you finish a successful project.
So two things. One is primary care. Two is clinical decision support systems. Primary care is a challenge everywhere in the world, especially in this country. And we are trying to increase the value of our healthcare now here in Saudi Arabia. And there is a big push with the new government and the new vision that we need to improve our primary healthcare to reduce costs, improve quality, improve healthcare coordination, because our patients are seeing 5, 6 specialists for multiple problems. So primary care is a big challenge, is a really good opportunity to create projects there. Two, a clinical decision support system. Here's the question for you. Do you think that physicians are up to date on every latest evidence out there? The answer is no. Do you think they apply every latest evidence? The answer is no. I used to follow up the latest antimicrobials, what the recommendation is for every antibiotic, for every infection, and I stopped that because it was so overwhelming. Now I use an application, I pay $30 a year, and I put in the infection that I'm dealing with. It gives me the latest evidence, the latest antimicrobials, and that's it. It takes me less than 1 minute to find that answer. So we need clinical decision support systems that bring evidence to the hands of the providers, to the hands of even the patients. You can even skip providers and go straight to the patients, where they can take decisions faster. Okay. So two things, primary healthcare and clinical decision support systems.
So for students,
To pick projects
pick those projects.
these fields.
These are two hot
Fields.
areas.
Yeah.
These are two
To
hot
pick
areas
projects.
in healthcare today, from my opinion.
For the student, I'm always a patient advocate. So I will actually a little bit shift the gear. I said, go and ask the patient. Take a mini internship. Spend some time in the outpatient clinics. Spend some time with the patient's families. Ask them what they need. because many of our patients, they don't have direct access, and the long waiting time to get to reach to a specialist can take a year or 2 or 3, some cases, some cases and some diseases, just to get a simple answer from a specialist. So this is one thing. If you sit with the people, ask them their language, what do they need, how you can support them to get a better access to health. And health doesn't mean only a physical health. Look at their mental health as a social aspect of their life. What do they need? What platform can you come for? What ideas, what research project can you work in to help them to come to this? This is my recommendation. If you're really into this, go and spend some time. Now, I know it is a digital health, but I think you need some time to go and sit one-to-one and to see people to know the problem. And this is what I do with my staff in the lab. They're pure technical, but I send them to the hospital sometime just to go and recruit some patient. And they get some nice idea. I mean, one of the projects came out just how to make patient enroll in this genetic study. And they came up with solution and things just from experience to go and working and asking them and getting rejection multiple times. So this is my small advice to you.
Yes, Dr. As Dr. Malik say, we need to ask patients. Sometimes patient tell you the solutions, what he want, and you don't need to spend a lot of time. You don't to form a complicated problems. Sometimes the patient give you what he seek and what he want. This is a good point to avoid a pure, not avoid, but be interested in clinical research also, not only pure scientific research.
So I would also like to add on the advice of Dr. Malik. But I would like to add that you should learn also from the medical professionals. And this is something that is a little bit underemphasized here in this discussion. We always talk about what KAUST can do for medical profession and what we are going to contribute, maybe some computational methods, and what other people can learn from us. But there is a big part of the problem which we need to learn. By we, I mean basic scientists or scientists working on technological advances, computer scientists, but also other kind of tech people, that we need to learn from clinicians. And this might be that the problems are not necessarily what you will read about in the news as to which algorithm has, again, beaten the latest state of the art and what the performance is. Now it's not 83%, now it's 87%, and tomorrow it will be 91% accuracy in some task. And it might be that you find out that nobody actually has this problem. Maybe the problem was even finding a clinician to treat you. And that is a very different task. Nobody will write a paper about how difficult it is to find a clinician who is actually the expert in your disease so that they can advise you. But this is something that maybe is the biggest problem for anybody. Once you see this clinician, you don't have to help them. They can diagnose or find some treatment for you, but finding this person, this is the hardest part. So the problems might be not where you expect them when you read popular science like Nature or Science journals, or also news articles about them. They might be somewhere else. So you should, or we also here at KAUST, our students, you students, researchers, and maybe also some faculty will have to learn also from clinicians about their work and what their problems are and what their constraints are.
Yes, in the local environment we're trying to serve. Nasser, you would like to add?
Yes, so there's something I think coming up in the future that people can take advantage of, which is, so when I did my clinical informatics fellowship in the States, we had 2 offices in our university, also in Nationwide Children's Hospital. One office is the biomedical research department, and then the other office was the chief medical information officer. So that's the operational arm, and that's the research arm. There was a beautiful link between these 2 groups. These people working on operational challenges and problems, and then seeking help from the research people. And the research people advancing technology advancing healthcare, and then communicating that back to the operational arm. Now, in Saudi Arabia, we don't have this yet. So even we have hospitals with electronic medical records that they don't have chief medical information officer offices yet. But I think as we adopt electronic medical records now in Saudi Arabia and implement more, this will evolve, and we will have more medical information offices, the operational arm in hospitals, and that will be a nice link between the people here interested in IT and IT health and digital health with these operational people to understand the problems and come up with ideas and communicate with them. And I think we'll start probably see this coming maybe 5-10 years from now.
Okay. One more question. We talked about digital health more on the perspective from patients and hospitals, but it's a field that encompasses the healthy, the people who are not complaining of anything, but still seek information for their well-being, the physical well-being, the mental well-being, the social, and even the financial well-being. And I'd like to hear from you your perspective from the current status in the kingdom about the use of digital health in consumer awareness, in training and education of medical students, of technicians, and so forth.
Yes, okay. Thank you very much. I think today I talked and stressed on the consumer health informatics, and I think consumer health informatics is one major area for research for the students as well. If we think as well in the same time about the major public health problem in this country. And now I'm saying what is the major public health problem? We're talking about, for example, obesity. We are talking about diabetes. We are talking about hypertension. These are the major public health problems in this country, whether for prevention, whether for treatment or management. And actually, we have these problems. And when we're talking about consumer health informatics, we are addressing more wider prospects. So it is not only the patients. We are trying to empower consumers. Consumers, they are our populations. So we would like to give them better access for healthcare, better access for knowledge, better access to be able to be more independent, so skip the healthcare providers, so you are able to manage your own health, take a proper decision, be able to be more determinant, so be able to search for information, find the proper information, integrate this information with your status, and then approach the proper health providers and engage more the family. And this is very important. When we're talking about the cyber-social networks, it's very important because most of cases, we need the support of the families. We need the support of parents or children, especially when we're talking about cancer, talking about diabetes. So it is very important to think about digital health as enabler. So digital health is enabler, especially we have the mobile health. Most of the population have a proper access to the internet, and they are now using social media, and then they are on the other side of our devices. So we should utilize this phenomena that most of the population, they're having access and they are online and try to use it for better health. So the concept comes under what we call consumer health informatics.
Thank you. Awesome.
Yes, so we see a push lately in about the last 2 years for application, things that can help patients take care of themselves. Dr. Mohammed Al-Hafdh in his presentation today showed a tweet from our Minister of Health using the app that counts his steps, and he was advocating for that. And that kind of the things that we want to push for. We want to push for the things that really help patients take care of themselves before they get sick. I also talked in my presentation today about how can we give patients tools to help them screen for diseases early on by themselves. And we need, on top of this, I think we need, which is very, very important, educational materials for patients that are more personalized and specific. If we know that you already have family history of certain diseases, you live in a geographical area, you are at a specific age, we know you are at risk of some certain things. And we want to push notifications to you. We want to provide you with information that helps you take care of yourself. If you are a pregnant lady, and we know postpartum depression is a prevalent thing now these days, we want to make sure that we support you before you develop your postpartum depression, which is basically becoming depressed after giving birth. So we know which patients are at risk, and we want to get to those patients and help them before they become sick.
So the help in building the content, and then the help in delivering that content to the people that would need it as
Yes.
their pair risk stratification.
Yes, exactly. As Dr. Ahmed showed in his presentation today, the number of people who have smartphones now is a lot bigger than anything before. And we know people have the digital means. We need to shape and make the message and deliver it in a way that the people can see it, can interact with it.
Yeah. Dr. Malak, especially the healthy in terms of, which you mentioned in your lecture, the genetic analysis that's becoming in the hands of many now, where you can sequence your genome, and what you think that as part of the digital health for the well-being and how careful we need to tackle it.
Yeah, as I mentioned today, one thing when you deal, many of you coming from different labs and groups, and maybe a few of you dealt with healthcare or medical data. What's unique about medical data, two important things I mentioned today. You have to really take in consideration legal and ethical issues in your account before doing anything, because here you're working with human data. So anything we design, we really have to take into account. It's not any other set of data just go and build. You really have to take into account the human factor into it. So one of the things it's not only my concern, it's concern many people in the field, direct-to-consumer testing or ordering without getting appropriate counseling before or after. And the worst case scenario, when you get a negative result after, and you think you are totally fine, you have no predisposition for anything, and then somebody come to me with some of the consumer thing. I said, by the way, do you know they only tested for X number of genes? There is like 20,000 other genes. They did not look for it, so you're not negative until you looked at everything. And even if you looked at everything, sometimes you get answer stuff that we don't know what does it mean today. That means you need to follow up for a few years what's going to change and how we're going to change our interpretation to the data. So that's why we don't advise people to do this. But on the other hand, back to your original question, what's happening in the kingdom? Now, I see it a different segment with different things happening in the kingdom. You have a young population, 60% of them less than 30, so that's one thing. Most of them are connected to the internet using digital. Second thing, you have very active now roles from the Minister of Health and the Ministry moving more toward digitalization and preventive medicine, so building also this is like steps, apps, the digital clinic, other thing. And then you have very specific segment of the population, women health issues, preventive issues, how to get ladies to go and do their screening. The screening they're supposed to do every year or every few years, how to push them to do it. Child health issues, men health issue. I was always talking about women, there is nothing for men. There is men health issue. You want them to do the things to take care of themselves. And then think about, learn from other nations. We have, right, it's correct now, we have a young population, but 20, 30 years from now, there will be old population. We need a more of to think about issues that will come with the aging populations. And that's what some of the nations are suffering now. I think Robert has some comments or some others working with the UK. They're having to work with some older population and aging issues. So how we can predict what's going to happen in this country after 30 years and 40 years. So this is some of what
prediction of disease burden, which can also
so we can be prepared.
Technology.
So we can learn from what's happening now, and we can prepare for the future and inform people how to take their own initiative, self-motivated initiative, how to live a healthier life. We don't want people to live longer life, and then we get all the burden and become really what the kind of quality of life want to live.
Healthy, long life.
We want them to live healthy. So if you can show them what's going to happen in 40 years if they don't do X and Y, I think this will be a strong motivation factor for me, at least.
So,
like,
Ahmed,
one example, remember when it comes this app would make you look age 40 years.
I think many, I know at least many of my friends that were starting to go to gym and eat healthy because they don't want to look that aged when they get into their 60s or 70s.
So
Let's
yeah,
open the floor for some...
Ahmed and Robert Soli, maybe we have only 10 minutes, therefore we'd like to have,
open the floor for questions,
Like-
interactions, comments to our panelists.
Over there, yes. Sorry, is there a microphone?
Can you hear me? Yes. Yes, I have one question regarding to the governance of the digitalization of clinical data. Don't you think we should to control it in a way that maybe if insurance company have access to some digital content of a patient, that will prevent patient from receiving or the equity of receiving treatment? How we can control this aspect?
Maybe Ahmed or Robert? Or? Yo. Nasser?
Yes. So this is a very good question. So if I screen early for my medical problems, or if I do genetic testing early for my medical problems, and then the insurance company knows about it, are they going to charge me higher premiums? Are they going to deny my coverage? Luckily, we don't have that big industry in Saudi Arabia as in the US. But we know that payment for healthcare is going to change in Saudi Arabia. We don't know yet how it's going to look like. There need to be policies around this to protect patients' information, and also policies from the other side where insurance companies cannot deny or cannot charge patients higher premiums based on their medical conditions. So those two policies need to go hand by hand, protecting patient information, in the same hand, protecting patients from insurance companies. But we see this as a challenge. It's we hear about it in the United States. It's a big challenge.
Yes, thank you. I think this is a really crucial question, and why I want to comment here, because there is two research. One of them has been published last May on telemedicine, and the other one is still in the publication about telepharmacy. And one major concern for pharmacists and physicians, and we're talking about more than 1,000 in the sample size, is the concern of the data privacy, the legal issue with using data, and I think this is a major issue that we have to think about, and we should have something like, for example, in the Information Act in the UK or HIPAA in the United States, and we should keep monitoring the practice and misconduct with data and update the data regulations day after day till we reach a proper level that we are happy as a patient, because we have to consider ourselves as the patients. But this is a major concern even for healthcare professionals as well as for the patients.
Yeah, and just to add one point, I think one very big challenge is you are looking at two faces of the coin. So we want to identify people who are at risk, so we can help them more, we can invest in them more, but at the same time we are running the risk of, if there is any data breaches, then these people will be identified as high-cost patients, and then people will deny care for them. But I personally don't think this is going to happen in Saudi Arabia, since healthcare is free and government pays for people's treatment. So,
may I ask a question, please? Here. I'm really delighted that Malik has addressed the issue of legalization as well as the efficacy of practices that came out from digital health, for example. And I think there are other two faces of another coin that really we need to be concerned about, and I would like to hear your feedback on this. The quick evolution in digital health, I think is great, and not only in digital health, but also in general, in digital in general. Yet, I think there's a lot of hindrance when it comes to the translation of this, of whatever, any innovation to healthcare. There's a lot of aspects that we really need to consider and organizations that we need to have approvals from. And hence, there are very tedious clinical trials that can take a decade to finish. So what do you think? Have we created a hindrance for ourselves to limit such innovation, the implementation of innovation in healthcare? I totally understand the one phase that Malak has addressed, which is the legalization and efficacy of the practices. Yet I think the other phase that there's a huge need for innovation, particularly digital, that can solve issues instantly. Yet they are limited by the ability to be translated in real life. What do you think about these two phases?
Rob, go ahead.
A very quick answer only. So I think there's always a huge need to translate things into new applications. I think we should be happy just making progress in basic research. Building a car engine took 500 years of physics, and before we will have cured all diseases, it will also take another 50, 100, maybe 500 years. So I think we're making rapid progress in translating all these discoveries. It's tremendous compared to the history, so I think we should just be happy with that. And of course, you can always try to make it faster and more, but I don't understand why. So I don't think the premise is actually right.
So I think, sorry, if I add the point, so I think one of the biggest challenges in adopting digital health and advancing digital health is policies. And that's why I think our government now recognized this very much and just created the Center for AI, we have another center for cybersecurity, we have a center for medical information, yes. And so they are realizing that policies are hindering the advance of digital health here, and they're trying to address it. It's not only digital health, but also other sectors.
Actually, from my perspective, the consumer health informatics, we have to look at also digital health from the social aspect, because this is going to be a culture. We are totally changing the culture of healthcare. So whenever we use new applications or online, so this is a culture for the patients, culture for the families, and even culture for physicians. When we started the first telemedicine in this country, the concern was, is the patient will be happy to be captured? But now the physician themselves doesn't want to be captured. So they are very keen what is going to be recorded and what's not going to be recorded. So it's a culture. And when you are talking about new culture, then you have to expect that it's going to go into different phases till we reach a normalized or a state that everybody is happy. And we recognize this as a culture of a digital health, that people, providers, and the society are happy about it. But I think we are doing a very good progress in the direction of digital health.
And if I may add one comment, the platform for clinical trials is changing around the world. There is a critical path initiative by the US FDA to change this phase 1, phase 2, phase 3, phase 4, especially for innovations coming from biotechnology, to introduce it earlier into the clinical setting within, of course, all of the controls. Also, we heard today, this morning, about digital clinical trial platforms, which is clinical trials from big data and then running it parallel to real-world data and then comparing the results. So I think everybody wants to speed up, to see the impact, but at the same time, as Rob said, it needs maturation of the basic science that could support all of the need at the clinical arm.
Okay, thank you so much. Very important questions, and thank you so much, panelists. And just I would like to say, from KAUST perspective, including students, we like to collaborate with medical domains, and if possible, we like to help. But more importantly, I think we have to make innovation by ourselves. Otherwise, it's just a helper. I think we have to take a lead to help, I think, this important issue. If we say 2000 as a information revolution, then 2020 would be digital revolution, including 5G internet new era. So therefore, I think this is very important moment that we have to work together. So before we conclude this panel discussion, Fadwa and myself would like to thank all the panelists, all the participants, in particular WEP team, Marilu, Nivian, and Khalid. We really like to thank you so much. Thank you.